If you are a midlife woman, perimenopausal, or going through menopause, and you are wondering why you are breaking out again with large cystic acne like you were a teenager, it's most likely your hormones. Now, you probably know your estrogen levels plummet during menopause, but what you may not know is that even when you're on hormone replacement therapy, that can also trigger acne symptoms, or if you're on things like testosterone. So the dosing of what you're taking matters as well. And hormonal shifts can trigger not only acne, but other changes in your skin. I'm Dr. Mina. I'm a board certified dermatologist. Welcome to my channel, The Skin Real, where I give real people real information about their skin health so that they can make informed decisions. Sound good? Let's get into it. This is my weekly recap episode where I break down my key takeaways from my most recent interview with Dr. Brenda Denneman. Dr. Denneman is a board certified dermatologist. She was on the show a couple weeks ago talking about menopause and an overview of menopause and skin. And it was so popular, and we still had so much more to discuss. So she came back for a part two. If you want to hear the full episode, be sure to stick around to the end of this short video and I will link it. So, talk to any woman who's 40 plus, 50 plus. They know their skin is changing. They know their body is changing during this period in our lives. I'm in my 40s. I see it as well. And these hormonal shifts that are occurring, again, it's all natural and normal, right? But we are also living way longer than ever before with pretty much zero estrogen in our bodies, and that there are some ramifications, not just with the skin, but throughout our whole body. One of the main complaints I see with my patients is that their skin has lost hydration and their skin is crepey. And I see this too. I was checking my elbows out working out the other day, and I was like, okay, definitely wrinklier than all the other people in the room who were in their 20s. So that skin loses hydration and no longer is as plump and youthful looking. A lot of this is due to estrogen. And so, one of the ways that you can combat this is by actually applying a topical estrogen cream. They're now making topical estrogen cream specifically meant for skin, like on our face, our hands, our chest, and neck. And we know that our cells in our skin have estrogen receptors, so that this can help with hydration. It can help decrease transepidermal water loss and make our skin look plumper and healthier. Now, I also get this complaint a lot too. Losing hair on the top of your head, but getting dark hairs on your chin, getting what looks like a mustache, or just a lot of peach fuzz where your makeup doesn't lay nicely and you look fuzzy. This is all, again, very common during this period of time. And there are some things that can be done. There's certainly topical things that can help your hair grow. I'm a big fan of oral minoxidil, and typically we reserve it for postmenopausal women. There are other medications you can be on that can help, and certain things like PRP can be helpful. And then for those dark hairs, those chin hairs, I really love spironolactone. This is a medication that can help combat that increased sensitivity of certain hair follicles to DHT circulating, and this can be helpful as well. There are also creams like a fluorinethine can be a topical cream used to help decrease that peach fuzz and dark hairs. And dermaplaning. I used to think, why would anyone dermaplane? But I have so many patients who swear by it. They say it gets rid of that peach fuzz. It helps their makeup lay nice and smooth. And so I recommend it. So if you've got peach fuzz and you want to do some dermaplaning, you can either go see someone or you can either get dermaplaning tools online. So that can definitely be helpful. Now, hormone replacement therapy is definitely having its moment to shine. For decades, women were not offered it. Will cause breast cancer. It's unsafe. And so it was a big no-no. There's a decade of women who were never offered hormone replacement therapy. But now the pendulum has swung the other way, where people realize the data was interpreted incorrectly, and that actually not only does it not cause cancer, but it can be very protective in our bodies for a lot of things, not just for our bones, but for our brain, our skin, our heart, dementia, diabetes, all these things. And so I am seeing more and more of my patients who are menopausal, postmenopausal on hormone replacement therapy. Now, hormone replacement therapy doesn't mean that you start taking it and all your skin problems and hair problems go away and you all of a sudden look 20, right? Hormone replacement therapy has different dosages as well. And when you're on HRT, if you're on estrogen and you don't have an IUD like a Mirena, and you do have your uterus, then you also need to be on progesterone. And this is something I thought really interesting. Dr. Dinneman was saying in some of her patients who are on hormone replacement therapy with oral progesterone that they will develop acne and sometimes really large cystic acne. And we can see this also, think about like birth control pills, right? That are a combination of estrogen and progesterone. For some women, and it seems to be the progesterone component seems to cause acne to flare. Or if you have birth control that is just progesterone, it can cause worsening of acne. And so if you are on hormone replacement therapy, you're taking progesterone and your acne is flaring, it may be time to talk to your doctor about tweaking that a little bit, maybe lowering the dosage, maybe bumping up the estrogen component and maybe lowering the progesterone component if that's something you're struggling with. Now, the flip side of that is you can also get acne by taking too much testosterone. And believe it or not, yes, women have testosterone circulating. In fact, we have more testosterone than estrogen in our bodies, even before menopause, which I thought was kind of crazy. We just have significantly less testosterone than men as women. Unfortunately, there isn't a testosterone formulated just for women at this time. And so, for women who need testosterone, perhaps for a variety of reasons, libido, muscle, things like that, they will be prescribed testosterone, but perhaps at too high a level for a woman. And so then we can see some issues with that. And we can see hair loss, like a male pattern balding almost. We can see more development of those dark hairs on the chin, the lower face, and of course acne. So making sure, so simply just being on hormones doesn't mean all your skin problems are going to get better, your hair problems. It's important to be on the right balance of hormones. So it's all about the balance with hormones. And it's tricky because in our bodies, there is just naturally fluctuation, especially as women prior to menopause. So it's important to tweak those dosages to make sure you're getting the benefit and minimizing the side effects of those. Because certainly acne, hair loss, and then what we call hirsutism, those dark hairs on the chin, is something a lot of menopausal women struggle with. So if you are struggling with that, maybe talk to your doctor, see about tweaking that a little bit because the type and dose matters. Other things to think about during menopause, if you are experiencing hot flashes, you may be having a lot of issues with sweating. And it just comes on out of the blue. You're having to carry a fan around. But there are some things you can do. Number one, getting on hormone replacement therapy can really help these symptoms. But if you've already on that, or it's not, or you can't be on it for whatever reason, there are some other things we can do. Botulinum toxins, so things like Botox, Xeomin, and Dysport, they actually prevent sweating. So if you've ever had it on your face, you may notice, oh, I don't sweat as much. But if you are sweating, especially in your scalp and hair, you can inject it there very safely to help prevent that excess sweating. If you are finding you're sweating a lot under your armpits or your palms, again, it can be injected in those areas to help. Not covered by insurance, not particularly cheap, but it is an option. And you can get pretty good, long lasting results with that for about 6 months or so, sometimes even longer for some people. You can also use things like glycopyrrolate, you either taking it as a pill, although that can cause some symptoms of like dryness, dry mouth, or you can have it compounded and use it topically where you apply it to the skin. That can help with the sweating that can sometimes happen during menopause, perimenopause. Now, what about supplements? It seems like everyone's trying to sell supplements, trying to tell you what supplements you need to take, and what do you really need, and what's a good use of your time and money and not. So, collagen supplements, I have tried them in the past. I don't think I tried it long enough to really notice a difference, but there have been some studies showing that collagen supplements, powders can actually help boost collagen in our skin. And it's because it's not so much that the collagen powder you're drinking goes straight to your cheekbones, right? That'd be nice. But instead, it actually stimulates your fibroblasts to produce more collagen. So, this I think is a pretty safe, affordable option. You can get collagen supplements in bulk, put a spoonful in your coffee, and hey, you might be getting some benefits from that. Certainly, focusing on your diet is key. Again, remember supplements are supplemental. So, first and foremost, trying to get the nutrients that you need for your body through food, limiting processed food and sugars. Those are going to form these things called AGEs, causing your collagen to get really brittle, break apart, not be beautiful and supple. Not smoking, that is a huge accelerator of aging and collagen breakdown. Making sure you're eating protein, right? During this phase of life, we are losing muscle mass, which is called sarcopenia. And so making sure you are getting enough protein in your diet, making sure you're eating enough. I know with all the GLP-1 agonists out there, appetite suppression is a real thing. And so you might actually not be getting enough calories in your diet, or you might be on a very restrictive diet. And again, this is not going to make your skin healthy and beautiful, and it's not going to be healthy for your body. Supplements that Dr. Dinneman and I both love, vitamin D. In general, we are just not making enough in our skin. And you might say, well, it's because we tell everyone to wear sunscreen. But studies have shown that that is not the real reason, that whether you apply sunscreen or not, people are still vitamin D deficient. So a simple way and a healthy way is to just supplement. Most likely, you need more than what's in your multivitamin. Recommendations now are even 4,000 to 5,000 international units a day, which is a lot more than what's in people's supplements. You can always get your levels checked if you're unsure. And really trying to be around 50 is a good goal, but you might be surprised. And we know vitamin D is so important for our bodies, for controlling inflammation, for our immune system, for hair, and keeping us healthy. So that's definitely one I think that's worth considering supplementing. Omega-3 fatty acids are really important. I eat a lot of salmon, so I don't supplement this. These can be hard on the stomach, but that's another one that people seem to like. Magnesium can be really helpful for sleep, and we know sleep is so important for our bodies, and you always look better when you are well rested for sure. Biotin, if you are taking loads of biotin, go ahead and just cut it out. It is not necessary. It is not going to help your hair, and it could actually harm your liver. So that's one that just needs to go. And there's so many things you can do that I know it can get overwhelming, and people think, I got to do all these things. You do not. If you're going through menopause and or perimenopause and you're struggling with your skin, talk with your dermatologist, talk with your GYN. We know that there are tremendous benefits with hormone replacement therapy if that's something you're interested in or an option for you. For skin, really the pillars for beautiful skin are not complicated. It's to think about it holistically. Think about your diet, exercise, sleep. That is so, so key, and I think we just overlook that and go straight to what supplements or what topicals should I use, but don't forget all that. Bare minimum for skincare would be a cleanser, sunscreen, and I love tretinoin or retinol. I think that is just one of the best bangs for your buck, that and sunscreen, and if that's all you wanna do, great. You don't need to do anything more. If you are interested in other things, wanting to make your skin look brighter, maybe you have some pre-cancers, maybe you have a history of skin cancer, you might want to look to getting something like a chemical peel or a resurfacing laser that actually has been shown to reduce the numbers of pre-cancers, and it will just help take away those decades of maybe sun damage that have added up and starting to show. So there's so many things we can do. You do not and should not do all of them. And that's where just having a great relationship with a dermatologist, with someone who can kind of help you map out what to do, when to do it, when to wait, what are preventative things to do to kind of stave off having to do bigger procedures. Again, because you don't have to do any of these, and it can get overwhelming and it's expensive. No one has the time or money to do all of this. And fortunately, it's not necessary. Educating yourself, taking care of your body, and then having someone you trust in your corner is going to take you so, so far, especially during this somewhat tumultuous and rocky period of midlife for many women. If you want to hear the full episode, be sure to check it out here, and I will see you next week.